when that person is gone, there's an immediate physiological reaction. It is that some aspect of us is tampered with, is amputated, right? And so how do I operate in the world, say, as a widowed person? That's not the same as being a single person. It's also not the same as being a married person. That's
Mm-hmm.
my identity that I now have to figure out. What does that person do?
Mm-hmm.
Or how do I think of myself as a parent if my child has died, right? So these changes to our sense of ourself are not only profound and difficult losses to deal with, but I think also research is starting to show have this physiological component, especially in the brain as well.
Mm-hmm. I'd like to welcome to the Journeying Soul, Mary Frances O'Connor. How are you doing today?
It's a beautiful day outside, and I am happy to be talking about this with so many people.
I'm glad to be helping to spread the word because this is a very important topic for me. And a lot of things in your book also personally resonated with me, but we'll get to that. So I just want to start with the setting out there that you are a doctor of psychology,
That's right.
but you also did a fellowship in psychoneuroimmunology.
That's correct. So my graduate training was in clinical psychology, and yes, trained as a clinical psychologist. But on the research side, I studied psychophysiology, and then, as you say, psychoneuroimmunology as well.
Can you explain what that is for people who are
Yeah,
listening who may not know?
yeah. Psychoneuroimmunology, or we just call it PNI because that's way too many syllables. Um, PNI is a field that developed mostly in the 90s, a little bit in the late 80s. And it really was an attempt to bring together what we understand about psychology, our psychological states, our motivations and emotions, and so forth, with what we know about the nervous system, the central nervous system, our brain, and our autonomic nervous system, or sort of
Mhm.
we think of it as cardiovascular, with what we know, with what was really a growing and continues to be a growing understanding of the immune system, inflammation and fighting off infection and so forth. Because we discovered that, of course, although, psychiatry, immunology, and neurology are different departments in a hospital, our body doesn't know that those are different, right? So there's a lot of interconnections between those aspects of our functioning, and understanding them in a research way means actually sort of looking at them at the same time in the same person.
Mhm. Um, I just want to share with you because this is you have a similar in the book, you talk about your diagnosis of MS
Yeah.
and how you felt that it had a connection to the illness and death of your mom. Though
Yeah.
you are a very good scientist and are very quick to point out that it's not necessarily a causal relationship, but
Yeah.
there's a correlation there. I also have a
Yeah.
similar story, not with MS, but
Ah,
I was diagnosed with multiple myeloma about 5 years ago,
yeah.
which I very much felt was I in had a connection to the caretaking and death of my sister in 2013, and then my father before that with Parkinson's, and then some terrible
Yeah.
things that happened at the funeral that were really just a trauma on top of everything.
Yes.
And I'm completely with you in that sense of like, yeah, I may have had a chemical exposure, but then the emotional stress, the
Mhm.
physical stress,
Yeah.
um, may have very much accelerated my diagnosis. So, I
Right.
am
It is often the timing, right, that similar, had risk factors already, might have gone on to develop MS. But the question is, why at that time, right?
mm,
When our bodies are under a lot of stress, they're not able to do the repair and restoration that
mhm,
usually keeps a lot of our disorders in check. And so the timing, as you say, when your body is under greater stress,
mhm.
emotional, physical, then that can be a moment where our predispositions kind of emerge.
Yeah, and it's not that it's not in your consciousness when these things are going on that you don't
Right,
feel well.
right.
Like, you don't feel energized, you don't feel happy, you don't feel peaceful, so why wouldn't
Yeah,
the rest of your cells be in that same camp?
that's right.
Yeah. I did want to, also just touch on something, this is kind of minor, but in the beginning of your book, you said your goal was to help people make a meaningful life in the face of terrible loss.
Yeah.
Which I think is lovely, but I also had to ask you that when you wrote it and the way you wrote it, it reminded me of the very famous Mary Oliver line of like, "What are you going to do with your one wild and precious life?" Which I might not be quoting exactly.
I love that line. Yes.
I heard the echo and I thought, "I
Mhm.
wonder if this is Mary Francis's way of saying that."
Yes, my closest friend is a huge Mary Oliver fan and has her poetry that she has handwritten in a number of the cupboards, inside a number of her cupboards in her house, and that is one that we look at often. And yeah, that is in part my way of trying to convey her wonderful sentiment.
Mm, I'm glad I caught it. The
Yeah.
little English student in me, though I didn't study
Yes.
that in school, was like, "Hmm." So anyway, back to our our main subject. So, one of the things I discovered when I went through the losses in my family was
Yeah.
really how bad we are at grief.
Mm.
Um, I don't know if we were ever great at grief, and I'll just keep it kind of in an American context because
Mhm.
different places have different cultures.
Yeah.
I know there was a time when obviously people waked their own loved ones at home and dug their
Yeah.
own graves, and you would put on an armband or mourning clothes so at least the society around you, the people around you would know you had been through something.
Yeah.
um, but I'm aware, and I know it's sort of a starting point for you, the fact that when people have losses, especially those very immediate people to like the ground zero of a loss, they have increased risk of stroke and heart attack, which to me is
Yeah.
like kind of common knowledge now, but I really don't think it is common knowledge. But
Yeah.
your work really dives into what I would say are sort of those longer tail illnesses
Mhm.
that are the after effect.
Mhm.
Now, outside of your MS diagnosis, what was the thing that put you into, I don't want to say devouring this as a subject, but really just diving into
Yeah.
it as a subject and trying to educate people about it?
Yeah. I think it's just as you say, as a scientist, I try to hold on to really clear facts and then sort of work to create more knowledge around those facts. And as you said, one of the first ones was really that, for example, we know from very large replicated studies uh, in the first 3 months after the death of his wife, a man is almost twice as likely to die of a heart attack compared to a man who's married during that time.
Mhm.
And it's similar for women, 1.8%, 1.8 times more likely to die of a heart attack.
Mhm.
And while that is a very clear fact that we can hold on to, then the questions, of course, are but why? How does that work? What are the mechanisms in our body that could account for these very clear physiological and medical outcomes when, the death is of someone we're in a relationship with, which, that love and bonding and even grief can feel quite ephemeral. How do we
Mhm.
pin that down? And as you say, I think the second fact that has really prompted me to stay in this area is that it isn't just cardiovascular deaths. It isn't just dying of a broken heart. But what we see is that there is an increase in all cause mortality for more than a year after the death of a loved one. So that means deaths from COPD and colon cancer and diabetes and pneumonia and right. And so as I was studying these things in my training, the question was, well, what on earth what mechanism on earth could cause this many different kinds of outcomes for our body? And that was when thinking about the endocrine system, our hormones, and the immune system, and especially inflammation,
Mhm.
those, of course, affect every single organ of our body. And so,
Mhm.
in my research early on, and now in bigger studies than mine, we do see that inflammation is increased in bereavement. So that's, inflammation is your joints hurt more when you have rheumatoid arthritis, and it's harder to breathe when you have asthma, right? So
Yeah.
the way that inflammation is affecting all those systems might be one key link.
I almost look at inflammation though as like it's kind of like hypertension on steroids. That's such a
Mhm.
mixed metaphor, but it's like the way hypertension was always called a silent killer.
Yeah,
Inflammation, unless you are really having the aches and pains,
yeah.
you don't really know that it's going on necessarily.
Mhm.
Do you feel that there should be more awareness in like medical practices and among the bereaved? Like you did mention in your book, very sage advice. Go to a doctor, get your
Yeah.
checkup after loss, which I think most people don't know to do.
Yeah.
That would be a great thing to sort of get out there to people. It's like, and I obviously, as we know, for so many people in grief, they might be taking care of like figuring out how to do the other half of the stuff that went on in their
Right.
house or estate stuff or just trying to get back to work. But in there,
Yeah.
they need to go to a doctor. And also, I mean, how do you feel about educating doctors to be screening a little bit better when those patients come in and say, "Oh, yes, my so and so died 2
Yeah.
months ago," or something like that?
Yeah, it's a combination, just as you said. There's a general grief literacy that would be helpful so that, you know, as you said, we often have to focus on many things when we're bereaved, and also our motivation can be pretty and energy can be pretty low when we're bereaved. In some ways, this is also then our role as someone supporting someone who is grieving, right? So how long has
Mm.
it been since you last had your mammogram? Have you had a colonoscopy, since you turned 50? Or have you been to your dentist this year for your just regular cleaning? These are the
Mm.
types of just regular normal medical care that would pick up things like hypertension or an abnormality on a blood test or an MRI, right, are going to be the things that then we would look to if there were problems. Now, the question around educating our medical community, clearly more education needs to be done. I will say there is a body of grief research that is really developing right now. And I was actually the Substance Abuse Mental Health Agency, SAMHSA, hosted what was called an expert panel on bereavement care last May. And this is part of their mandate to try and understand where is the evidence right now and what could we do to improve surveillance and then follow up, right? And intervention if necessary. The the knowledge base of what is the most effective way to assess for bereavement medical outcomes and how to intervene with bereavement medical outcomes is still in early stages. So we have some of this early data,
Mhm.
like some of the studies I've been describing that we have done in my own lab and in others around the world. But we're still early on. If you're going to ask, are you bereaved, and find out what someone's grief severity is like, we need to have clear guidelines for then what does the medical professional do. So
Mm,
my
mhm,
fear, for example, is that suddenly people would be put on antidepressants, which we know is not is it can work for depression but is not usually what people are experiencing during
mhm,
bereavement. And so we also don't want them to be asking about bereavement and then making incorrect interventions. So I think we're just really starting to come together to come up with policy guidelines and training guidelines for our medical community.
yeah, I mean, you bring yes, absolutely. That is the exact, truth. It's like if you're gonna test somebody or screen somebody,
Right.
then for what end
Why?
if you're not then treating them? So,
Exactly.
yeah, so it kinda
Yeah.
gets left there.
Yeah.
On this podcast, I'm changing the focus of the podcast, but whereas this portion of the podcast will probably just be about loss and bereavement, things like that.
Yeah.
But it has been about healing loss, connecting with spirit, and manifesting a new life.
Yeah.
And in the connecting with spirit portion, we've had a lot of discussion about where consciousness comes from
Mhm.
and after death communications and things like that.
Mhm.
Your book, though, did seem to resonate with the idea that consciousness doesn't just reside in the brain, to the extent that we have any idea what consciousness is and where it might be, but that you're talking about a lot of cases where the immune system, it's not just in the brain, though. I know towards the end of the book you do discuss how the brain and the immune system talk to each other, how they speak to each other. But how do you feel about the idea of consciousness in all the cells in the body?
I think it really depends a lot on what we mean by consciousness. So to the degree that we mean awareness, the ability for the being to be aware, the human being to be aware, that I think does reside in the brain. However, as you said, the interconnected information between the brain and the body is extensive.
Mhm.
And I think that if we're talking about whether the immune system, for example, has a memory of something that it has previously seen, this we know this is how the immune system works.
Mhm.
It has a memory for, oh, I've seen this virus before. I'm already partway, up to making a strong response for this virus I've seen before. That kind of memory we know is a part of the immune system. However, that is not available to conscious awareness. So that's sort of where I fall
Mm,
in that sort of question.
right. Okay. So another thing that you discuss in your book is attachment theory in regards to loss.
Yeah.
And I was particularly moved about how, I mean, I've often looked at my loss and like when I've spoken with other people when they're going through their time of grieving is just how the biggest I think the biggest thing that happens when we have these losses is your identity is put up into the air. And that's the thing that's very I think I've always thought is the most difficult. You come at it from a point of view about attachment theory where you say the brain is going to look for the us, like
Yeah.
that it's got this concept of us.
Mhm. Yeah, when we bond with someone, when we fall in love with our infant or, fall in love with the person who becomes our spouse, um, that person is encoded in our brain. I mean, quite literally, physiologically encoded in our brain. And we know more and more from neuroscience that there are parts of our brain that understand, okay, this is me, and then a parts of the brain that understand, okay, this is them, but parts of the brain that are responding to we, that, as you say, are encoding in us. And that happens, we can even see that in pair bonded animals, right? So these little voles, these little rodents that run around in North America who pair bond for life. Once they have fallen for their specific other vole, they will spend the rest of their life with them. And what we know is that those physiological changes in the brain are happening even there, right? Even without sort of all the conscious elaboration of falling in love and having a wedding. Um, so, what that means is when that person is gone, there's an immediate physiological reaction. It is that some aspect of us
Mhm,
is tampered with, is amputated, right? And I think while metaphorically that feels right to a lot of us who have
mhm,
had grief, I think there's a way in which it's actually operating that way in the brain as well.
mhm,
And I think even our language, right, it can be helpful in thinking about that. So, for example, I might use the word daughter to describe myself, right? If someone says, describe yourself, that's probably one of the words that would come to mind.
mhm,
But the word daughter implies two people in the world, doesn't it?
mhm,
Right? The
mhm,
word spouse implies two people.
mhm.
Even the word best friend implies two people,
Yeah.
even though it's a word that I would use to describe myself. And so how do I operate in the world, say, as a widowed person. That's not the same as being a single person. It's also not the same as being a married person. That's
Mm-hmm.
my identity that I now have to figure out. What does that person do?
Mm-hmm.
Or how do I think of myself as a parent if my child has died, right? So these changes to our sense of ourself are not only profound and difficult losses to deal with, but I think also research is starting to show have this physiological component, especially in the brain as well.
Mm-hmm. And also in regards to, you can see when when you're looking at it through that attachment theory, the us
Yeah,
framing, how it could so easily interact with your immune system, which is always on the
yeah,
alert for like the not me. Like
yeah.
these are our cells, this is what we're doing. What's this thing doing here? And when you scramble that idea of like this is me, this is the immune system's going to be
Yeah,
the
I think
technical term.
right. Yes, exactly. The exploding head emoji, right? I don't think of it so much. I don't think the immune system suddenly recognizes that other person's cells as though they are part of oneself. So just to, I know that's a little in the weeds, but I do think of it this way. The absence of that person is going to increase our stress hormones, our cortisol, our adrenaline.
Well,
And those, yes, will
I'm not saying
reduce
it
our
doesn't I'm
immune.
not saying the immune system recognizes the other. God, we're gonna go like total I am now here. Anyway, the other, but that the idea of the I has
Yes.
shifted. So it's
Mm.
like it has to, I would assume there's that recalibration that goes on with, well, what is I?
Mm.
In terms of the
Yes.
fact that it's supposed to be protecting I. I don't know.
Mm. Yeah, yeah.
I
I do think you're right that it can cause the recognition that part of me is missing, part of us is missing, has clear impacts on cortisol and adrenaline, and
Mhm.
those have clear impacts in reducing immune function. Yeah,
Yeah.
yeah,
You also talked about the other our others as external pacemakers, which I
yeah.
really I thought that was beautiful. I thought that was a beautiful way to put it
Yeah.
and also an accurate way to think about it. That when you especially
Mhm.
when you're living with someone,
Yeah.
their habits in the house do help set your habits in the house,
Yes.
and it can be so disorienting.
Oh, so disorienting, right?
Yeah.
And even, I mean, again, thinking about sort of even just really concrete examples, I know that, when I come home from work
Mhm.
and I get that hug from my spouse, my heart rate literally decelerates a little bit and my blood pressure literally drops a couple millimeters mercury. So in that sense, his presence is genuinely directly sort of impacting my cardiovascular function. And if
Mhm.
right now I think about going home and getting a hug from my spouse, just bringing him to mind also can decelerate my heart a little bit, right? So it's the how do we transform our understanding of this relationship that we've had? How do
Mhm.
we transform it so it continues to have these positive physiological impacts for us, even while we know that we won't get that physical hug again?
Yeah. You this and yeah, those stressors. Which
Mm,
reminds me of something else that you write about in the book about restoration
mm,
stressors,
yeah.
which I thought was so brilliant because,
Mm,
I've read a lot on grief, been as you know, been through it, but
yep.
that was the first time I came across that the concept of that, and I thought that
Yeah.
is really so key
Yeah.
as for everybody who's grieving to have an understanding that this really I almost think that's one of the primary things that's stressing you when you're grieving
Yes.
is trying to figure out the restoration. Can you just explain restoration stressors to people a little
Yeah.
bit?
Yeah. So, this theory, which we sometimes call the dual process model theory, was developed by brilliant researchers Maggie Stroba and Henk Schutt. And they realized as they were doing grief research and reading about grief research that we were very focused on the loss oriented stressors for good reason, right?
Mhm.
So, focused on, oh my goodness, now we have to deal with waves of grief. Now we have to deal with wanting to avoid certain things, right? And the difficulties that can cause. We have to deal with challenges in concentrating and, all the things that are related to the loss. But their brilliant contribution was that's only part of the stresses we have to deal with. The other half is what they called, so loss-oriented stressors, they called restoration-oriented stressors. And this is, how do we live life now?
Mm.
Right? So this is, how do I deal with all the tasks? You just said it a few minutes ago in this podcast. How do I deal with all the tasks? I've never done the taxes before. I don't have all the passwords. How do I figure out? I remember in a study we were doing in my lab, one of the young widows talked about having to have conversations with her son, where her husband, her deceased husband, should really have been the one having those conversations and trying to figure out how to find the words, right?
Mhm.
That's not specifically about the loss. It's about, how do I live life now in a way that makes sense, that can be meaningful, that sort of incorporates what has happened into my day-to-day ongoing existence. But in fact, I think the most brilliant part about what they've contributed with this dual process model is that they talk about oscillation. So they say when people are able to sort of go back and forth between dealing with the loss and dealing with restoration, that is actually the sign of mental health. People can get sort of stuck just
Mhm.
thinking about the loss, and other people
Mm.
can get stuck just thinking about restoration, right? Like, how do I make all the changes? How do I make it, how do I working so hard and blah, blah, blah. And it's really the ability to do both
Yeah.
that contributes to sort of ongoing mental health.
Yeah. I mean, again, I just think it's a wonderful concept. I mean, I focused with when I worked with other grief counselors, we
Yeah.
always talk about the phase of like making meaning, where
Yep.
you've kind of started to synthesize who the
Yeah.
new you will be,
Yeah.
but it really is so difficult, whether it's just figuring out, well, who am I now? As well as like, how do I run the dishwasher or the, stuff, things
Well,
like that.
right. What
So,
will I do in retirement? My
yeah.
all of my retirement plans are built around us. How do I even begin to think about what that looks like? Yeah.
Yeah. Yeah. I also love that you said towards the end of your book that you are striving for a world in which no one grieves alone.
Yeah.
How's that going?
Hmm. So this is the motto of our local Tucson area bereavement support group. And specifically, it's really focused around children who are grieving a loved one, although there's groups for parents and even young adults. But um, I think it is such a brilliant way of putting it that they've come up with. And I think, we forget that grief affects everyone, but it doesn't affect everyone in the same way, right? And so figuring out, what does this person need to support their grieving
Mm,
process, it takes time and effort and questions and
mhm,
trying things and providing that support. We forget also, I think, that, bereavement is a health disparity, meaning that, if in different communities that we have different life expectancies, which of course we know is true, then it means that in some communities, people are dying more frequently. We sometimes call it too many too soon,
mhm,
meaning that, for example, in the pandemic, Black children were twice as likely to lose their caregiver, and Native American children were 4 times more likely to lose their caregiver. And so, thinking about, if we're going to improve grief literacy, if we're going to improve grief support across the population, we have to think about, how are we going to do that in a way that makes sense for what different groups of people are coping with.
mm. Yeah, I think too that kind of it brushes up against so badly like people's idea of shame attached to
Yeah.
loss, even though they don't speak about it,
Yeah.
where, there's kind of a societal abandonment or pull away because
Yeah.
this is not representing health. This is not
Right.
representing wealth, excellence,
Yeah,
whatever the thing that people are chasing. And yet, I, I mean, my biggest frustration is just the fact that we're all mortal. We're all
yeah,
going to die.
yeah,
Yet obviously many people can go through so many decades of their life without even really being touched by a real
yeah,
loss,
yeah.
and they have no vocabulary for it,
Right.
which in a lot of ways makes their own end of life much worse because
Yes, right.
their
I
first
don't have
loss could be like losing a parent in their 60s, and it's like,
exactly. I
yeah,
don't have any skills to know. I don't necessarily have any experience to understand what I'm going through, and also I don't necessarily have any skills of how do I soothe myself? What actually works to comfort me?
mhm,
If you don't have a sense of what those things might even be, it's going to be a much harder process.
yeah. Personally, I just always wish we could that for grief, there can be a good part of tribal energy. We see a lot of tribal activity in politics and religion and sports, and it's not always like high level tribal
Yeah,
activity.
yeah.
But tribes could be very good when a member of the tribe died
Mhm.
and everybody recognized it and recognized the loss. And anyway, that's just my pie in the sky. Like, that could help.
I think that community response can be so important. I mean, we know how important social support is in having someone adapt well when they're grieving. And it's interesting, there are many ways in which, even within our American context, we see things like this, like Jewish communities that sit Shiva, right, for 7 days with their community members. Or I was reminded of a wonderful example recently. There's a an Irish football organization, and they have sort of like we do, a little bit like we do Little League here. There are these Irish football associations in every little hometown, and the head of this organization, Irish organization, was talking about how they very specifically teach the club members how do you respond when there's a death in your community, and talked about teaching the kids, when you go over to the house because they're having a wake, you
Mhm.
can bring the chairs from the football club, right? So
Mm,
bringing the chairs from the football club is a really instrumental way of helping this family who probably doesn't have enough
mhm.
chairs in the house,
Yeah,
right? And I just thought that was such a lovely example of something very basic, but let's approach this situation. Let's engage with this family that's grieving. And here's some tools of like even some things you might do. I thought that was
yeah.
just a marvelous example.
Yeah, I'd love for that to spread because, yeah, that's a great example. Usually the way that fire departments and police
Yeah,
departments handle it when they've had a
that's
loss in
right.
terms of wrapping around the family.
That's it.
But yeah, but we
Yeah.
don't have a lot of it. So in reading your book, I could not help but wonder in a way, like, what would the end game be here? Like, would we be talking about, developing I mean, and I'm not saying this is what you're about, but
Right.
would we be developing a pill to treat grief? So we mitigate the physical ailments. I'm thinking, is it going to be some sort of AI matrix thing where you can, put somebody in a virtual reality and ease them through it? I was like, oh, I couldn't help but wonder what the future is going to hold
Right.
in terms of how society might wanna handle these grieving people, you
Yeah.
know?
I think, one of the things I'm really struck by is that grief is the totally natural response to loss. And we have been doing this for as long as there have been relationships. Our brain, our body, our mind, our relationships, our community can develop the skills of how to respond to loss. And, I think of this may sound like a silly analogy, but I think of it a little bit like pregnancy. So, grief is not a disease. Grief is not a disorder. Just like pregnancy is not a disease. And yet it's a very physiological event, right?
Mhm.
And it's a time of increased risk for other medical outcomes,
Right,
gestational
like
diabetes and hypertension and so forth. And because we understand that, our society has developed whole prenatal care programs, right? And to some degree, even postnatal care programs,
mhm,
so that we can help educate people who are going to have a baby. What are some of the physiological changes you can expect? And
Hmm.
then also doing assessment of, is this process going in the way we expect it to? Are you having the physical changes that are natural in this process? And then if they're not, now you already have a system set up so that we can intervene if things start to go awry.
Hmm.
So I think ultimately of this as being kind of a great model for when someone is bereaved, teaching them about what some of the physical reactions are very likely to be.
Hmm.
Then also having a system of care in place so that if they start to recognize, okay, so during these waves of grief, my heart rate goes up, my blood pressure goes up, and then it comes down again, right? That's the whole
Hmm.
point of it being a wave. Our body is built to do that resiliently as we understand the impact of this loss. But
Hmm.
to recognize, but my body could get outside the physical parameters of what is normal and healthy. And if that starts happening, I really need to be seeing someone who can help me either with the skills of how to manage the grief that I'm experiencing,
Hmm.
or if we get outside the bounds of, blood pressure or inflammation,
Yeah, I mean,
getting
just if even if
physical.
you're not cycling and you're just
Right.
staying there, yeah.
Yep.
Hmm.
Exactly. So I think that's, I think that's a very doable social change that we could have.
Yeah. Okay. Well, Mary Frances, if you print another edition of A Grieving Body, which I'll hold up because
Yes.
I didn't before, I
Yes.
think that should be like the new sort of end word is that we need some sort of, I mean, I'm going to call it post vivo. I don't know. It's not
Oh, I like
prenatal.
it.
What do you want? But there
Right. I
should be like
like
a,
that.
a post vivo program
Support.
that,
Yes.
yeah.
Post Vivo care. I love
Yes.
that. I
Yes.
love that.
Well, you brought up prenatal, so I
There
just
you
followed you
go.
down the road.
Right?
All right. So, Mary Frances, let's wrap this up so we can
Yeah.
send you on your way.
Yeah.
Are you ready for my lightning round of questions?
I'd love it.
Okay. First one is, what does a well-lived life look like to you?
Think that's going to vary person to person. We talk about this in my clinical psychology classes where I'm now training new clinical psychologists, that mental health, the World Health Organization, talks about being able to resiliently respond to stressful things that happen in one's life, but also feeling that one is able to make a contribution in their relationships, in their community, and those things can be true kind of regardless of other physical or mental health issues you might have. So I think for me, it's being able to have meaningful activity and the full range of human emotions, good and bad, that come along with this life we get.
Hmm, nice. What do you suspect is the true nature of reality?
Hmm. That is an excellent ongoing question, isn't it? I think,
I ask everybody.
yeah, absolutely.
I'm hoping somebody says something and I'm like, yes, but none of us really know. But what do you think?
This question is influenced both by my scientific understanding and also some of the Buddhist study that I've done, because they talk about and think about and have studied this question for thousands of years. I think that I don't know. I'm very curious what our scientific investigations will continue to hold, but I think the true nature of reality is different for every human being, and that simultaneously the life, the spirit of life, continues to sort of, yeah, infect each of us with within that reality we perceive.
Mm. How do you feel that people should take care to stay connected to their consciousness or their soul?
Mm. In the grieving body, I write a lot about my own life sort of experience of the need to be silent and allow for a time when you're not using words, where you're not being bombarded by stimulus from outside, to sit quietly and listen to what's going on in your mind, what's going on in your body, Those to me, and doing that in a practice sort of way, meaning not just you accidentally find yourself without, with a dead phone and, oh, I guess I have to sit here without any distraction, but doing it intentionally, like actually taking the time to sit quietly, maybe in nature, maybe at home, to really listen to what's going on in your mind and your body.
So many people on this podcast have talked about meditation being the key. But
Yeah.
you also did remind me of an anecdote in your book about how you went on retreat and you
Mm,
weren't allowed to speak. And that
that's
was
right.
very difficult for you.
It was terrifying initially. The first few days of the retreat, we did not speak, and it was a Buddhist retreat. And it was also one of the most profoundly changing experiences of my life. Yeah.
I know I have a loved one who would also be challenged by the not being able to speak. I
Yes.
mean, I know it's kind of like everything where, when you're on retreat, you will get over that hump, but that
Yes.
was the hump that I think would be difficult for her. And
Yeah.
I know you said it was difficult for you. So
Yes. But now I'm no longer afraid of it, which is pretty wonderful.
that is great. That's what those retreats are for. So
That's right.
yay.
Yay.
When you die, assuming our consciousness survives in some way or your soul, what do you hope to discover?
Mm. Well, that's a big context, isn't it? Whether our consciousness survives or not. I don't know if it does or not. I don't really have a strong belief that it does. What I hope to discover is that as I am potentially losing that consciousness, I hope to discover that I have used this one wild life I've been given as well as I possibly can.
Mary Frances, I'm not offended if you think that when we die, that's it.
Yeah.
I thought, I definitely had that belief for a while, but I've had some experience that have changed my mind. But I have many other guests who's like, nope, it's done. When you're done, you're done. And that's completely a valid point of view. So
I mean,
you
I think
you don't have to hedge for me.
yeah, no, I mean, I think from my perspective, what clearly goes on is every single person I've ever affected and touched because I am then a part of their consciousness. And so I think I am woven into all consciousness, even if I no longer personally am consciously aware.
Hmm. And now a profane question
Oh,
by comparison.
okay.
It's not terrible. Where can people find you and the good work that you're doing? Where should they find your book? What do you
Right. So the book, which is also available as ebook and audiobook options. In fact, I read the audiobook version this time around of The Grieving Body.
Oh, did you love that? So many
I
people love
did.
recording their
Yeah,
audiobooks.
it's definitely a skill set. In any case, books are available anywhere books are sold, and more information on my lab is at maryfrancesoconnor.org.
Okay, and I will hold up again. We have The Grieving Body, and your previous book is The Grieving Brain
Grieving
for anybody
Brain.
who's interested.
Yeah.
And any final words you'd like to impart on the audience today?
Boy, I just really appreciate you bringing this conversation to people.
Oh, thank you. I appreciate the work you're doing so we can have the conversation. I
Good.
am certainly not articulate enough to go out there and just bring it up. So thank you. And Mary Frances, thank you for your time today.
Yes, thank you.
Thanks for watching. Click to join us on another journey, and don't forget to subscribe.